My name's Bill Haden. I work at Rutherford Surgical Associates, and I'm a general surgeon here in the county for a long number of years. One of the real reasons to get a mammogram for women is to catch a cancer before it turns into a big cancer. And one of the first things some cancers do is to put down a little calcium, and that's picked up on the mammogram. Stereotactic biopsy allows us to biopsy that area without making a big cut on the breast. And it's very accurate and not very painful. These are done as an outpatient in the outpatient department. Takes about 30 minutes and go home shortly after that. Comes back negative, in other words, no cancer, which 90% of them do, then the only really follow-up is 3 months from the procedure. Of course, we see them back in the office, but 3 months from the procedure, we get a follow-up mammogram to make sure we got what we're going after. In other words, no complications, etc. Usually when there's stones or in the gallbladder that's symptomatic, usually causes pain after eating, especially greasy or fatty foods, and once that starts, the only cure for that is to take the gallbladder out. I'd say 95% of the time we do them through the laparoscope. It's one of the biggest changes in medicine that I've experienced in my career is the laparoscopic cholecystectomy is much easier on the patient and actually much easier on the doctor. Usually go home the same day, but stay out of work for about a week. In fact, my wife had hers out and she drove to Chapel Hill 2 days later, so usually it's not too much of a post-op problem. Usually for about a month after you have your gallbladder out, you'll have a few extra bowel movements a day, but other than that, it's you can eat what you want to.